Organisms such as bacteria, viruses, fungi, or parasites can be harmless or even helpful. But under certain conditions, some organisms may cause disease. Infectious diseases, on call with the Prairie Doc. Health information based on science, built on trust.
It's good to learn these things,
Good evening and welcome to the 21st season of On Call with the Prairie Doc. Medical information based on science, built on trust. I'm Dr. Kelly Evans Hullinger, your Prairie Doc host. Tonight we will be discussing infectious disease. Thank you for joining us. In the studio this evening on the campus of South Dakota State University in Brookings is Dr. Jawad Nazir from Avera Medical Group, infectious disease specialist. Welcome, Dr. Nazir, and thank you for being here.
Thank you, Dr. Evans, and thanks for inviting me to the show.
Yeah, there's always so much to discuss. This is probably my favorite show that we do every year because lots of fun to discuss and we pick your brain about infectious diseases.
Sure, we are here.
Yeah. So you work in Sioux Falls primarily. Tell us a little bit about what you do as an infectious disease physician.
So as an infectious disease physician, our practice is focused primarily on patients presenting with a broad range of infections and in all settings, clinics, hospitals, and sometimes in the long-term care facilities. So it's a broad range of infectious disease ranging from very complicated infections in the hospital, like patients with septic shock, really complicated pneumonias, meningitis, severe skin and soft tissue infections, infections in patients who have very low or poor immune system, like patients getting chemotherapy or organ transplant. So very complicated patients in the hospital setting we see, and then some of those patients we have to continue to follow after they are discharged from the hospital because they are on antimicrobial treatments, which needs to be monitored closely, and they have a lot of adverse reactions. In the clinic setting, we see patients with undiagnosed infections, unexplained fevers, patients with HIV, immunosuppressed patients with infections not improving. They're not sick enough to be in the hospital but not getting better. We also see patients for travel consultations, patients who are traveling globally and they need advice on how to prevent infections, ranging from general advice to use of medications and vaccinations. So it's a broad range of infections in all settings.
Yeah. And I know that the hospital systems also look to people like you when it comes to things like preventing the spread of infections in hospitals or decreasing our antibiotic use appropriately. So probably a lot of committee and advising work too, huh?
So I think apart from seeing patients, which actually is about 80% of my work, as you mentioned, we are engaged in some of this work preventing infections, like being part of the infection control program, because when we talk about these infections, some of them are spread very rapidly in healthcare settings, like some of the Clostridium difficile infection, MRSA, infections due to resistant bacteria. And I think the hospitals are concerned, and nationwide I think there is a lot of guidance how to prevent this for a couple of reasons. One, once these bacteria become resistant to a variety of antibiotics, we do not have enough drugs to treat. So unfortunately, majority of these patients die, or they remain hospitalized for a very long time in the hospital. And secondly, these pathogens are the ones which spread very quickly, very rapidly, and the patient next room or on the next floor with a very poor immune system, could catch that infection. So the patient may be coming for something else, like an acute myocardial infarction, or abdominal surgery or any other reason, but they end up getting an infection due to a resistant pathogen, and then their course in the hospital is prolonged. So it does not have, not only it has an impact on the patients, it has impact on hospitals because the length of stay is prolonged, or the cost of care is high. The hospitals are kind of stretched to max these days. There are patients who are really complicated, cannot really get into the hospitals, so it kind of delays treatment for many patients. It's a cost thing too. It's costly, so there's significant cost. In fact, the cost of infection due to resistant bacteria is in billions of dollars, so it's very significant. And then also, as you mentioned, COVID, I think part of our role has been to guide our hospital administration, on the steps they can take, to prevent spread of COVID in the hospitals, as well as the help we can provide as infectious disease specialists in public health, educating not only our providers, but the public as well about the need for vaccination, which is so important not only in COVID, but prevention of so many other infections, which leads to the end result with hospitalizations and death, So, and then I think guiding our providers about the new treatment options, and especially like COVID. So, so it has been a very interesting last few years.
It's been a fast couple years, I'm sure, for you.
Definitely, yeah.
Before we go further, we invite you, our audience, to submit your questions for tonight's discussion about infectious disease. Viewers can contact us 3 ways. Call 1-888-376-6225, send an email to ask@prairiedoc.org, or ask on our Prairie Doc Facebook page. We will work to answer as many of your questions as possible given the time available. Sometimes we do receive more questions than we can cover, and we apologize if we do not get to your question. To encourage you to ask early, all questions asked in the first 20 minutes will be entered into a drawing for one of our Prairie Doc gift items. The winner will be announced at the end of this program. Your question will remain anonymous, but please provide contact information when you submit your question. So it's a timely day to be talking about vaccines because it's flu shot season, right? Tell us about what are we expecting, or what might we guess flu season will be like this year? What do you? It sounds like we're seeing influenza, at least in the southern United States, right?
Yes.
Maybe not so much here in South Dakota yet.
We have seen several cases in South Dakota. Okay. I think there are more than 10 cases already. I don't know the exact number. But you're right. I think with the COVID, with so much emphasis on masking and preventive measures like social distancing, the last couple of years we did not see a significant number of patients with influenza. But one of the things we have to watch very closely is what has happened in the southern hemisphere. So, like if you look in Australia, sometimes the influenza activity there predicts what can happen here, and they actually had one of their worst seasons in the last several years. With a lot of infections, causing severe disease, hospitalizations, and mortality. And in some parts of USA, like in New York and Texas, they have already seen a significant, I think in New York city area, over 1,000 cases. If they look at the number of cases at this time of the year and compare it to the similar time, same time last year, it's a significant rise.
Yeah.
So I think our concern is, and I think it's, nobody could be 100% accurate, but I think we are anticipating a tough influenza season. As I think our practices, masking, all those measures are, getting relaxed. There's a possibility, that we may see a higher number of cases.
Yeah. On that note, who should get a flu shot? Who should get a flu vaccine?
Well, I think everybody, age 6 months and above, should be getting the flu shot. And I think with vaccinations, as with COVID, what we have learned is that we not only get these vaccine like influenza or COVID to protect ourselves.
Right.
We get it to protect people around us. So people in our household who are elderly, people who have immune deficiencies, or their immune system is weak due to a medical condition or a medication they are on. If we are a healthcare worker, we think about the patients we are seeing. Many of them have very weak immune systems. So, I think one lesson we have learned with COVID is that we don't only vaccinate for ourselves; it's for the people around us.
Yeah.
Now, patients who everybody should get vaccinated, but patients, or people who have chronic medical conditions, which puts them at a higher risk to have a severe disease.
Yeah.
Now, severe disease means patients ending up in the hospital. It means patients dying from the infection.
Right.
So, for example, somebody who has diabetes, who has a chronic kidney disease, chronic liver disease, lung conditions, congestive heart failure, obesity, patients who are on medications which decrease their immune systems. These are some examples of patients, who can have bad complications, who can get severe disease, who can end up in the hospital. So those should definitely get it.
Yeah, good. While we're talking about flu shots, I'm sure we'll get a question about the updated COVID vaccines. Tell us what you know about the newer bivalent COVID boosters and what you're recommending to your patients.
Yeah, I'm very strongly recommending it to my patients, and in fact, I have gotten it myself about a week ago, along with my flu shot. So one thing is that I got both of them and didn't have much of an issue, So I think the reason to strongly recommend is that the pandemic is not entirely over yet. You know, I think when you look at multiple countries in the world reporting increasing cases and hospitalizations, it's very hard to say it's over. But I think fortunately we are in a very manageable phase of this pandemic. I think the speed with which these vaccines have been developed, and they are one of the safest vaccines actually. They have been given to millions of people, and it has prevented so many infections, so many hospitalizations and mortality. I think that's really a miracle. I think if we think in that direction, I think we go through a lot of comments about the vaccines, but considering the speed with which these vaccines have been developed and how safe they are and how much impact they had in this pandemic to on the health of people, I think it's nothing less than a miracle. Now, why it is important to consider booster? Because virus is evolving. It keeps on evolving. We started with alpha, beta, delta, Omicron, and then we have subvariants, and then as the subvariants emerge, they primarily mean that there is mutation in the spike protein, of the virus, and with these mutations, some of the previous vaccines we have used become ineffective, not completely ineffective, but they kind of their efficacy decreases to prevent severe disease, especially in patients who are elderly or have immunosuppressive conditions, So the most recent strain prevailing globally and in USA, we have been BA.4 and BA.5. There are a few other strains now emerging as well, but the bivalent vaccine, has a component of the ancestral strain, and but it also has coverage for the current prevailing strains, and I think it's a good way to energize your immune system to develop the antibodies, which will cover what is going on right now, the strains which are causing disease right now. So I think getting booster is very timely because we are getting into winter months, there are going to be holidays, nobody can predict, more variants, We are hoping that we will not see the kind of infections, the numbers we had seen last year and the year before. But I think we have kind of become, desensitized to the numbers now. So we say, thousands were dying. Now 300 people are still dying per day, and I think we don't sometimes think, we are out of pandemic, but it's okay. But 300 per day is a significant number.
More than we would ever want.
So still, I think we need to focus our, efforts to encourage people to get the boosters to help, the ones who are vulnerable primarily.
Good. Well, we're getting some questions from our viewers. We have a caller from Sioux Falls actually asking about the fluid COVID-19 vaccines. She asked if they're dead virus vaccines. So let's talk about what type of vaccines these are. Let's start with COVID-19.
I think the messenger RNA vaccine, I think is the concept, which is like serves as a messenger, to generate the production of antibodies, targeted against the spike protein of the virus.
So not a dead or a live virus vaccine, actually, kind of a different type
and
altogether.
It can be given to people actually, who are immunosuppressed because it does not lead to replication of the virus in your body. It's not like a live vaccine. So it's very safe, and I think in our experience in the last several years, it has been given to a lot of immunosuppressed patients and have protected them.
How about the flu vaccine? What type are most flu vaccines? What type of vaccine?
These are the vaccines, which are kind of targeted to cover the most recent strains, like H3N2 and H1N1, the alpha, the influenza A and B, And there are types of vaccines, which are high dose, primarily, for patients who are above 65, to generate a higher immune response. These are not live vaccines as well.
Not live.
So,
made with killed virus, actually, right?
Yeah. So they do not lead to replication of the virus in your body, like the flu block, the Fluzone, the Fluad, so those are not live vaccines as well.
Yeah, good.
But the only distinction is that 65 and above, we do recommend the high dose vaccine.
Right. Yes, and we seem to have a better supply of that than we've had in years past.
Yes,
I've at least been able to give them to all my patients, I think. So we have a caller from Sioux Falls who says they've had 4 COVID-19 shots. So I suppose, the 2 in early 2021 and then the booster last fall and then another booster this spring. Wondering if it's safe to get a 5th shot.
Yes, I think the recommendation is that it should be at least 2 months from your last, booster shot. I think the early data which is emerging, and there's a very comprehensive surveillance system for monitoring of the adverse reactions by CDC. So far we have not identified any data or any concerns that the COVID bivalent booster, which has a lot of people have already received it, has led to any increased adverse reactions. It's the same kind of the method, the messenger RNA vaccine. So the adverse reactions are pretty much similar to ones like local injection reactions, a little bit of a fever or a headache or a fatigue. In fact, I think in my personal experience, those were little milder this time, But I think there's also studies which have shown that if you get some of those reactions like little fever or body aches, that just means that your immune system has reacted very well. So you probably are generating a higher antibody response, which may be more protective for you. Yeah.
So if it's been more than 2 months, not only safe, but recommended to get
highly
this
recommended,
vaccine. Good. We'll change gears a little bit. We have a question from out there about sexually transmitted diseases. Are STDs like gonorrhea, syphilis, and chlamydia becoming antibiotic resistant and not being able to be treated as well as before? I guess let's talk about what are we seeing in the world of STDs? We're seeing higher numbers.
I think what we need to worry these days is very high number of syphilis. Case in South Dakota, compared to previous years, we have seen dramatic increase in the number of syphilis cases. Unfortunately, congenital syphilis as well. So in pregnancy, if syphilis is not treated, you can have congenital syphilis. So
meaning the new baby comes out infected and can have some major problems.
Yeah, it can come out sooner with problems. Or maybe may not be born alive. So I think that is concerning. That's why I think there's a lot of emphasis, by our state health department and medical professionals, for timely screening. So maybe enhanced screening, like early in pregnancy, at 28 weeks in 3rd trimester, and maybe at delivery. So I think that screening is really important, and also in the other groups, sexually active, individuals, the MSM population, I think it's very important to test, because if you test early, you can treat and decrease transmission. So I think that's a concern right now in our state.
Just finding
diagnosing these cases in a timely fashion. In regards to treatment, I think there's not much concern for resistance with syphilis treatment. That's still the old benzathine penicillin,
Yeah, it's one of the few infections that it's penicillin all the way, right?
And I actually had a patient just last Friday, a 28-year-old girl, so who actually was in 1st trimester and diagnosed with syphilis. She actually had a very bad rash and tested positive as a part of the timely screening by her, gynecologist, and she unfortunately had a very terrible reaction to penicillin as a child, as anaphylactic reaction. So we had to bring her to the hospital and desensitize her. So
because that's we don't really have another good choice.
The other choices are not as good. There's not much data, and somebody's pregnant, you want to do the best, so we actually desensitized in the hospital setting and gave her penicillin, and she did fine, So I think that's concerning. For some of the other infection, there is concern like gonorrhea. I think there is increasing resistance, to some of the antibiotics, which is emerging. But with COVID last 2 years, some of that surveillance has actually dropped. Like I think one of the issues that we have knowledge of some microorganisms becoming more resistant, but some pathogens, some of the surveillance efforts have been lost. So we do not have an exact idea of how resistant they are.
Right.
But I think in the next 6 months to 1 year, we'll have a better idea where we are.
Labs
with that.
were just preoccupied with monitoring COVID.
Yeah.
Okay. Well, on that note, an infectious disease that has been on the rise in South Dakota and the country is syphilis. Prairie Doc reporter Sam Shower spoke with the South Dakota Department of Health about the increasing number of cases.
Angela Casillo is the infectious disease director with the South Dakota Department of Health, and she says syphilis cases have sharply risen since 2021 in South Dakota and nationwide.
It has continued to increase since that time, both nationally and in South Dakota and in surrounding states. We're currently experiencing over a 2,100% increase over our 5-year median baseline.
Casillo says the main age group being affected are those between the ages of 25 and 49.
The age range of 25 to 49 is our age range that we're seeing primarily infected. And we do have cases, under the age of 25 and over the age of 49, but primarily within that age group. It could look like maybe just a little pimple, a little herpes. Maybe a lot of people mistake that for a herpes infection.
And then the signs and symptoms vanish, but the disease is still in your body for a lifetime if unchecked, and that can lead to serious health problems in the future.
It's not producing any symptoms. People don't think there's anything to be concerned about. And then later on, it can be 10, 20 years later, there are manifestations that can occur. And most of those are neurological in nature.
Casillo says the best way to prevent STIs like syphilis is to be open with your healthcare providers, along with getting tested and practicing safe sex.
So if you are sexually active, you need to be practicing safe sex. The other key piece is testing. Anyone who is sexually active should be testing themselves, and not just for syphilis. I mean, we're seeing a rise in all sexually transmitted infections, so they should be testing themselves for all sexually transmitted infections.
And if someone does test positive for syphilis, it is important to talk to a healthcare provider for treatment.
The treatment is very easy. It's a shot. It can be up to 3 shots depending on the stage, but if you catch it early, you can go in, see your healthcare provider, and receive 1 shot.
And notify any partners to have them tested and treated to mitigate the spread.
And then also to notify any partners that you've been with that they could be at risk, and it's important for them to receive preventative treatment and testing as well.
Great message. I tell my patients, if you ever have even the least bit of concern, let's test for STIs. And even if it's just sort of a maintenance, for some patients, doing once a year testing is very reasonable, because some of these infections don't cause much in the way of symptoms.
Yes, yeah. I think that's a very important point, because you can have minimal symptoms or asymptomatic. It can manifest weeks to months later.
Yeah.
Unfortunately, in small number of people, it can manifest many years later with severe complications involving heart and brain.
Yeah.
So I think getting tested early and getting treated early is the best course. So completely agree with the great message.
Yeah,
so.
Absolutely. And it's easy to test for. It's usually urine and blood testing, or maybe in women a vaginal exam.
Yes.
Yeah. Good. Well, we got a bunch of different questions, so let's just get after some of these. We had a caller ask about seeing something in the news after the hurricane, talk about a brain-eating amoeba. And is this something they should worry about in lakes or from the ocean? And I think they're talking about Naegleria.
Yeah,
and we
Naegleria
have seen
foulerii. Yes,
yeah.
So
there was a case more in the Midwest even recently, wasn't there, Jawad?
I have not seen a case here, but there may be a case here. But it's pretty common in the underdeveloped countries. People who are swimming and young boys who are jumping in the lakes. Leads to sometimes kind of fracture of like a cribriform plate of your ethmoid bone, with a lot of water pressure.
Yeah.
So I think these waterborne organisms, can penetrate, get into in the central nervous system and cause infection. It's pretty very very kind of, severe infection, very hard to treat. Almost 100% mortality with that infection.
It is. It's a scary thing.
Yeah.
We don't see it very often in the U.S.
We in South Dakota, I think we have not. Maybe there have been few cases, but it's just, I think, a reminder. I think to be careful when we are jumping and diving, in the lakes. So,
Okay. We had a caller. This is an interesting question. How can it be safe to have bacteria living in our gut, but dangerous to get those bacteria, for example, in a wound or another part of our body? This is an intelligent question, alluding to the fact that we do have bacteria living all over and inside of us.
Yeah.
And how can those bacteria not cause harm, but maybe in the wrong place they do cause harm?
Yeah, that's actually a very great, very interesting question. So, in our body, we have more bacteria than the cells we have. Our skin is full of bacteria. Our GI tract, is full of bacteria. But then I think, our body organs like skin and the gastrointestinal tract, has functions. And skin actually, one of the functions of skin is a barrier to infection. So although these bacteria are living in a very healthy manner, on your skin, if there's a break in the skin, for some reason, then I think that barrier is kind of lost, and these bacteria can get underneath, and then they cause infection. Some of those infections can be very, very severe. So if they are not in the part of the body where they are supposed to be, depending on what the bug is, they can be troublesome. In the GI tract, there are a lot of bacteria. They live, in kind of a balance. Sometimes when we overuse antibiotics, we kill the normal flora of our gastrointestinal tract, which creates a vacuum, and some of the others like Clostridium difficile can start growing. They can start producing toxins, and cause severe infections. So I think when we do something to disrupt the normalcy, the natural habitat of these bacteria, I think it causes trouble. Another example is like the chemotherapy. When patients get a lot of chemotherapy, that kind of destroys their gastrointestinal tract, makes them very weak, very friable, and it gives a chance for those enteric bacteria, because the mucosal barrier is now very weak, they can translocate, get into your bloodstream. But now they're not supposed to be in the blood. So if they get to the place where they're not supposed to be, they will cause infection. Then they can go to any part of your body. They can metastasize. Cause septic shock. So I think it's a very interesting, nice balance. With the bacteria, we have friendship with them. But if they are at the place where they're not supposed to be, due to a number of variables, then I think they can become very pathogenic.
Good. Let's see. We have a question, another one about the flu vaccine. Why does the influenza vaccine have to be redesigned every year? What is it about influenza that makes it so uniquely changing?
Yeah, I think I don't have a good answer to that question. I mean, if it was so simple, we could have just developed one vaccine. I think the way it evolves, it's so different, and I think it's very hard to predict, like which strains, would be predominant, and the vaccines, I mean, they do their best to kind of fit in the strain with the composition of the vaccine, but it's still never, we don't expect it to be 100% effective. I think our goal is to prevent severe disease here again, so severe disease meaning hospitalization or mortality, but people can still get infected.
So it's the influenza virus's fault. It's how it changes every year that makes it hard on our vaccine makers,
and
right?
It's very hard for us to predict which way it will evolve, every year.
Yeah. Good. We have a question from Arlington. How contagious is RSV, respiratory syncytial virus? How can you reduce the risk of exposing babies, and why are we seeing so much RSV this year? Tell us a little bit about RSV and what kind of illness does it cause?
So it's a respiratory syncytial virus, primarily in children, can cause very severe respiratory tract infection. It can involve the upper respiratory tract, so like, people like cough, runny nose, but sometimes go down the tract, involves the lungs, and, patients can become very short of breath, get into respiratory failure, get hospitalized, unfortunately die as well, Again, I think in the last 2 years, with a lot of, masking and, like a lot of, good things we did to kind of mitigate the risk of COVID-19, it's possible that the population exposure and baseline immunity to some of these infections, including influenza and virus, and RSV and some others, may have decreased. So as I think we are relaxing now, there is minimal baseline immunity to fight these viruses, and we are seeing a rise. RSV definitely. We are seeing a significant increase nationwide with RSV, and I think a lot of clinics nationwide are very busy with patients, children presenting with it, and unfortunately sometimes adults can get very sick from it too, especially.
I had a patient that was hospitalized with RSV last year, I think.
And I think especially, again, patients with decreased immune system, they are highly vulnerable to severe disease from RSV. How to prevent it? There is no specific treatment for it. There is no vaccine for it, unfortunately. But I think some of the basic infection prevention measures, like good hand hygiene, trying to avoid places where there is RSV, overcrowded, and seeing your provider, if you are concerned about it, if they get worse, they need supportive care.
Right.
I think some of those basics we still have to implement to fight it. Yeah.
It's a good reminder. If, as an adult, if you have a cold, don't go visit your family or friend that has the new baby or a small child at home, because a lot of
if you are sick,
adults, when we get RSV, it's kind of a cold, but you can spread something that might be really dangerous for that baby.
Yes.
Am I hearing talk about an RSV vaccine under development?
Yes, I've heard about it, and I think it may have been tried in a certain group of patients, but I'm not sure if that's has been implemented in a broad range of population or ready for implementation
Still
yet.
In trials.
But I think there are some encouraging news I've heard too.
That would be good for our babies.
Yeah.
Okay, we have a caller from Sioux Falls wondering if shaking hands can increase the spread of disease, and should people avoid shaking hands with one another? Gosh, I've wondered this. I used to shake every patient's hand when I walked into the clinic room, and then I didn't for a long time, and now I'm wondering, am I missing it, or am I okay without the handshake? What do you think?
I think I would say it's a personal choice, here. I think when you shake hand in a hospital healthcare setting, definitely there is a risk of transmission of some, hospital-acquired bacteria, and it's possible. But then we have hand hygiene too, So I think if we practice good hand hygiene, we should not be worrying about handshakes. That's, I think, cultural. It's personal choice, and I won't discourage people with handshakes. But I think with the understanding that it can transmit infections, so in focusing on your hand hygiene and hand washing, I think that's important.
Maybe it depends on the setting and whether you can wash your hands quickly or not. Huh?
In hospital setting, personally, we don't do too much of handshakes, to decrease the risk of infection in the clinics, But if a patient will, push his hand forward, I will definitely shake the hand. We can do the hand hygiene later. It should be fine.
Okay. We had a caller ask, is there a vaccine for Lyme disease?
Yeah, I think this is a question has been asked multiple times, and I have not heard about it so far. I think maybe there is something in development, but I've not heard about a vaccine, which is very efficacious, to prevent Lyme disease at this point.
Yeah. Do we see much Lyme disease in South Dakota?
It's
much more common further east in Wisconsin and even Minnesota. But
in those areas adjoining our state, there may be some cases, but it's not very significant, here.
We don't have the right ticks here in South Dakota, right? We had a question, is a staph infection considered a severe infection? Let's talk about staph and what this patient is calling staph. What is this bacteria, and what kind of illness?
So there are different types of staph, for example, Staphylococcus aureus, which is what we call a coagulase positive. Then there's coagulase negative. So there's a big dictionary of staph, But I think it's a good question because some staph infections are very serious. Staph aureus, and again, I think I mentioned that where they are, which part of the body they are. If they are in the blood, that's a big deal. If you have Staph aureus in the blood, is one of the tough infections to treat, because staph is what we call a very pyogenic, like pus producing, causes a lot of inflammation in the blood. It can go to multiple sites in your body, infect your heart valves, get to your brain, get to your bones, get to any hardware you have, cause tough problems, So staph in the blood is a major problem, staph aureus, and unfortunately some of these staph aureus have become resistant to, so what we call MRSA, methicillin resistant staph aureus. That is even tougher to treat because our antimicrobial options are kind of limited when we are dealing with resistant bacteria. Now, if it is in a wound, it's not as complicated or doesn't have that much of a high mortality compared to the blood, but still it can cause a lot of infection, inflammation. It can spread from a wound to a bone, so I think it depends what is the site of the infection, we worry about blood and what type of staph it is. If it is like staph aureus or one of those others coag negative, which are not as bad as the staph aureus, and then I think how resistant they are to the antibiotics. We also worry about the host. I think that's another thing. We worry about the bugs. We worry about the host too. If someone is really young, he can clear the infection very, very quickly. The good immune system. The antibiotics decrease the concentration of those bacteria. Your immune system takes over, and you're good. Somebody with a poor immune system doesn't happen like that way. They actually struggle. So if someone has a poor immune system, meaning they are on chemotherapy medications, they had a transplant, they are on steroids. So they are elderly. Just age is another factor too if you're above 65. So depending on the host, the outcomes are also related to what kind of patient we are talking about. So I won't ignore it. Staph is a tough one. It kind of reminds us the importance of antimicrobial stewardship too, a little bit. So,
I assume that staph aureus probably is one of the more common bacterial infections that you see in the hospital.
Very common, and for some reason I'm seeing more and more of it. Like I've seen 2 staph aureus in the blood today, actually. So I was just thinking today, like, why are we seeing more staph aureus in the blood these days? Is it just a coincidence, or we're going to monitor this a little bit to see, But definitely, I think staph aureus in the blood is a very serious infection.
Good. South Dakota State University is known for its agriculture programs, but did you know they host a food safety lab as well? We spoke with Dr. Russ Daly and Dr. Joy Scaria from the Animal Disease Research and Diagnostic Laboratory about how they are keeping South Dakotans safe from foodborne pathogens.
ADRDL, Animal Disease Research and Diagnostic Laboratory. So every state has something like this, a laboratory that's dedicated to animal health, and they help the animal producers, the animal owners, and the veterinarians in those states answer questions about animal disease issues and animal health issues. We have an R in our name, besides the diagnostic lab, that indicates we do some research. We really specialize mostly on livestock here at SDSU in this lab because of the part of the country we're in. A lot of beef, a lot of dairy, a lot of swine, sheep and goats.
The research in my lab, addresses the human and animal health from a perspective of One Health. The idea is that human, animal, and environmental health are tied to each other, and we need to address all these 3 things as a whole.
It's very common that we'll work with human disease issues that originate in animals. And some of those disease issues we start with the animals, and that's where the problem first comes up.
We are unique in a way when compared to other diagnostics labs because our lab combines research and diagnostics. So the focus of our food safety lab is to keep track of the foodborne pathogen incidents both in humans as well as animals. So we are a Food and Drug Administration affiliate lab for state of South Dakota. In that capacity, we do multiple things. One is we go into grocery stores, buy random meat and other samples, bring them to the lab and test for presence of bacteria like Salmonella, E. coli, Listeria, and Campylobacter. These are the 4 main bacteria that we test for.
Well, so this all started with a call from the Department of Health, a couple of illnesses in people. They identified an unusual strain of Salmonella.
The strain's name is called Salmonella bongeri. And it is a atypical strain of Salmonella that you usually never see infecting people.
The health department, one of their jobs then is to try to figure out where this infection came from. So they will interview the patients and talk about food sources and what animals that they contact. And it turned out that these two households had both had bearded dragons as pets in the household. As the state public health vet, when an animal thing is involved, then they reach out to me. And so we determined that we could try to get some samples from those animals and then kind of see, okay, is it the same thing in the animals as it was in the people?
And then what we found was that the Bongori we isolated from the pet and the kids were 100% identical. So it's an interesting case where both Department of Health, our lab, and work together, and we use the information from previously reported cases, and we could tie it all together. ADRDL is a unique lab because being in the university, gives us, additional leverage in terms of being able to use the high-performance computing capacity on campus. Graduate students developing, new tests, and then working with the staff in the diagnostic lab.
The ADRDL really helps SDSU in a lot of different ways. It provides research opportunities for our researchers who can get grants then and hire students.
Great segment. We were just talking before the show, Dr. Nazir, about how infectious disease sometimes is like being a detective trying to get to the bottom of where did this odd bacteria come from, and that was a good story about the bearded dragons.
Yes. No, I think it kind of covers the topic of zoonotic infections. And there are many other examples like Q fever, for example, rabies. The infections we can catch from animals. So I think we got to be a little we
have a lot of those in South Dakota, actually.
Yes, and I think that brings that concept of One Health, which is being talked about, that we live in this environment, animals, humans, food, everything is kind of climate, everything is kind of linked, and I think that understanding those linkages are important in our understanding of zoonotic infections.
Good. Well, we just have a few minutes left. We'll try to cover all these viewer questions. We had a caller from Rapid City wondering how long MRSA can stay in a person's body after infection. So we're talking about Staph aureus infections. If someone does get a bloodstream infection, how long does that person have to be on antibiotics?
Again, I think it depends on the host and severity of their infection and so many variables. But I think generally they require weeks of antibiotics, especially if they're it's in the blood. If they have any prostatic material like a heart valve or a joint, maybe even longer, like sometimes 6 weeks. It kind of depends how they are responding. But I think we have to differentiate a little bit from like what we call colonization and infection. So I think infection would mean when staph is in the place of your body where it's not supposed to be, like in the blood, and it's causing disease. But staph could be in part of your body where it's supposed to be.
I might have some on my skin right now,
and it's not causing disease. So if it is on your skin, it's not causing disease. It's colonizing you. So we do not treat colonization. That's a very important concept. But I think for infection, especially depending on where it is, it may require prolonged treatment and so many variables, which we have to look into as we monitor these patients.
But some of those patients do end up requiring an IV antibiotic for, like you said, 6 weeks or more.
4 to 6 weeks.
It's aggressive. A caller said a few years ago in the news there was a measles outbreak in Minnesota. What is the danger of measles? Specifically, they asked for a pregnant person.
I think that's significant. That kind of brings the importance of childhood, immunizations. And I think one of the disruptions with COVID has been a breakup of the childhood, immunizations. So I think the outbreaks have happening, where immunization rates have been low. It was also an outbreak in New York and some other parts of USA as well. But I think in immunosuppressed individuals, including pregnancy and others, even measles can cause severe infection infection in adults as well, so.
Yeah, something we don't want.
Yeah.
A similar question, this person had chickenpox as a child. We do not hear much about this, and is it because of the childhood vaccine? When did we start vaccinating infants for chickenpox or varicella?
Several years ago.
Yeah, I think it's probably been closer than 15 or 20 years ago, maybe. Yeah.
Yeah, I don't remember, but more than a decade ago, maybe 15 years ago. Yeah.
Sure.
Yeah. So I think that's also important, so, because that can cause severe disease as well, in children as well as in adults as well.
Yeah, but that's really changed from
when
we
the
were kids and everyone got it.
Yeah, now we don't see too much of that. So.
I saw a young adult about a year ago who did have chickenpox that hadn't gotten their childhood vaccine. So it is still out there for people who don't get their vaccines.
Yeah.
On the line of chickenpox, we had a caller ask about, can stress cause shingles? Or what typically causes that shingles outbreak? Random,
I think
sometimes stress.
Sometimes waning immunity, I think,
Yeah.
and I think if your immune system is, compromised due to a disease you get, if you get put on medications, which can decrease your immune system, I think that can bring it on, the reactivation, So stress has a major role in a lot of things. I don't know there's correlation with infections, but I think that's maybe possible.
Yeah. And compared to our old shingles vaccine, the one we have now as of a few years ago is really effective. So recommend that to adults over 50.
Over 50, the shingles vaccine, 3 months apart, 2 doses is highly recommended.
Yeah, good. We had a caller from Sioux Falls wondering about whether certain blood types are more resistant to COVID-19, specifically if type O is more resistant. Is there anything to that? I've had that question from patients, and I don't have any knowledge that there's any truth to that.
Not sure. I mean, there may be some truth to it. I don't know if it has been researched to the point where it has some clinical implications for us.
Sure.
For example, in my practice, I still have to recommend vaccines to everybody, regardless of their blood group.
Yeah.
Because I think everybody is susceptible. But I think there's a lot what we do not know about COVID. Still, I think it's 3 years. But I think it's still it's a young disease we are trying to understand, and I think there'll be more information about it, But I think at this point, what I would suggest is, regardless of the blood group, vaccination is important.
Right. Yeah, good. In our last couple of minutes, let's talk a little bit about, we're coming sort of out of a really heavy couple of years of learning about a new virus and this pandemic. What lessons do you think we've learned to take forward, looking for the next pandemic, which probably is sure to come in our lifetimes, I would assume?
You're absolutely right. I think, if you look in the last 10 years, there was the SARS-1, which came around 2001, 2002. Then we had the MERS, the Middle Eastern, virus. Then we had the Ebola scare, which affected a lot of people in African countries. Fortunately, not too much in USA. Right. We had the Zika, globally. And I think we talk about COVID so much because it has affected USA more than any of those. But globally, a lot of these are happening, and I think with the globalization, travel, maybe climate change, I think there's a possibility for us to see another pandemic, and maybe sooner than what we think,
Right.
So I think the lessons learned are very, very important, I think a major lesson, I think, is how we develop trust, trust between the providers and the patient, the government, the health departments, and how we develop collaboration.
Yeah, agreed.
So I think developing trust and collaboration can save many lives.
Yeah.
In a pandemic, nobody can be right 100% of the time. 100%,
right.
Always, in
we
every scenario.
Week to week, right?
Yes, we all learn through phases,
Good.
So I think that's important.
Hopefully that will all serve us well going forward.
Developing trust, I think, is really important. Collaboration is important. And I think following science, is important.
Good.
We have gone through a lot of phases where we did what we, it was difficult, to try everything, but with time we learned what worked, what didn't work,
Right.
So
good.
Yeah.
Thank you. The winner of our prize tonight is Chris from Arlington. Thank you, Chris, for asking a question during the first 20 minutes of the show. A gift will be sent to you, and we'll be back after this.
Miss an episode or looking for a specific topic? Head to our YouTube channel or website, prairiedoc.org, today to access all On Call with the Prairie Doc episodes. And make sure to join us most Thursdays on SDPB and Facebook for new shows.
As a lover of the history of science and medicine, one of my favorite topics to read and learn about is the discovery of germ theory. Up until the mid to late 1800s, diseases had numerous other theories, and the theory of miasma, meaning bad air, dominated as an explanation for cholera, plague, and other infectious outbreaks. Bacteria themselves were seen and discovered with the development of the first microscopes in the 1600s. Dutch scientist Antony van Leeuwenhoek is credited as the father of microbiology, having created the early versions of our modern microscopes. Though he saw microbes with his inventions, the idea that these tiny organisms cause disease was yet to be discovered. Germ theory, though it had beginnings smattered in earlier times, really did not take off until discoveries by 19th century thinkers, including Louis Pasteur, Joseph Lister, and Robert Koch. This was an exciting time to be a biologist, and in my opinion, these careers are all worthy of blockbuster movies. By the early 1900s, an enormous shift had occurred, and the idea that microorganisms could cause disease was well accepted. Initially, the discovery of germ theory was most useful in prevention. Sanitation of water and food went a long way toward decreasing outbreaks of previously common diseases. But another huge change occurred in 1928 with the discovery of penicillin. Penicillin was a chemical compound secreted by a type of mold, which Alexander Fleming found killed bacteria. By the mid-century, many other antibiotics were discovered and ultimately used to treat bacterial infections. Antibiotics are certainly one of the greatest advancements in the history of medicine and have saved countless lives worldwide. However, as our ability to treat them has advanced, bacteria have continued to evolve. By numerous processes, some types of bacteria have changed in ways to evade once effective antibiotics. At the same time, development of new types of antibiotics have slowed to a trickle in the 21st century. Life-threatening bacterial infections for which we have no or limited ability to treat are a real concern of experts in infectious disease. The challenge of our era, I think, is mitigating the danger posed by antibiotic-resistant infections. The most important step we can all take is to reduce the use of antibacterial medicine when it is not necessary. Challenges for our hospital teams include looking critically every day to see if and which antibiotics can safely be stopped in hospitalized patients. Preserving the efficacy of this precious resource will be the work of all of us. Thank you to our guest, Dr. Nazir, for volunteering his time to help us learn more about infectious disease. If you would like to see and hear more episodes of this program, please like and follow us on Facebook and YouTube, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online, and be sure to look for the podcast of this program, Prairie Doc On Call, wherever you get your podcasts. So from all of us here at On Call with the Prairie Doc, thank you for joining us for another episode of health information based on science, built on trust. And until next time, stay healthy out there, people.
While kidney stones and bladder issues can affect men and women, enlarged prostates, prostate cancer, and low testosterone are some of the reasons to see a urologist. Men, your health, your body, urology. Next time, On Call with the Prairie Doc.
Based on science, built on trust. Join us in supporting the Prairie Docs as we enter our 21st season. Hello, my name is Dave Heinck, and I serve on the volunteer board of the Healing Words Foundation, a 501c3 charity that secures funding for Prairie Doc programming. This past year, we celebrated 20 seasons of truthful, tested, and timely medical information from our 4 Prairie Docs, each of whom volunteers their time to answer important health questions. Thank you to our viewers who continue to help make this programming possible. You are making a difference for public health information in our state. Your donation allows us to continue to deliver on Rick and Joni Holmes' mission, set out over 2 decades ago. As a friend, supporter, and volunteer for this organization, I believe in its mission and I know the vital impact it makes in our communities. Please continue to follow us on social media, on South Dakota Public Broadcasting, and YouTube. If you're so inclined, you may make a donation online at prairiedoc.org. Prefer not to donate online? Reach out to us via email and our staff will send you a pledge form. Thanks again for supporting our mission and Prairie Doc programming. Medical information based on science, built on trust.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello, possibility. Hello, healthy.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information.
and with the ongoing support of these individuals and institutions. Brookings Health System, Ophthalmology Limited, South Dakota Academy of Family Physicians, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Vance Thompson Vision, Monument Health, Black Hills Medical Society, Brookings, Madison, Flandreau District Medical Society, Pierre District Medical Society, Sioux Falls District Medical Society, Yankton District Medical Society, Orthopedic Institute, Lake Poncet Sailing Academy, Aberdeen Asthma and Allergy, Dakota Bank, South Dakota American College of Physicians, and Swiftel Communications.